The gallbladder. The gallbladder is part of the digestive system. It is a small pear-shaped organ located on the right side of the body, under the right lobe of the liver. The body can function without the gallbladder. If the doctor has to remove it because of illness, there will be no serious long-term effect and the body will still be able to digest food. Structure. The gallbladder is 7.5 to 10 centimeters, 3 to 4 inches, long and about 2.5 centimeters, 1 inch, wide. The gallbladder is composed of several layers of fabric. Mucosa, inner layer of epithelial cells, epithelium, and lamina propria, loose connective tissue. Muscle layer, smooth muscle layer. Perimuscular layer, connective tissue that covers the muscle layer. Serous, external lining of the gallbladder. The gallbladder, liver, and small intestine are linked together by a series of thin tubes called ducts. The common hepatic duct drains the liver of bile through the right and left hepatic ducts. The cystic duct connects the gallbladder to the bile duct. The bile duct, formed by the junction of the common liver duct and the cystic duct, ends in the small intestine. The combination of gallbladder and bile ducts is also called the biliary system or bile ducts. Function. The gallbladder stores and concentrates bile, a yellowish-green liquid produced by the liver. Bile helps the body digest fat. It is mainly composed of bile salts, bile pigments, such as bilirubin, cholesterol, water. The liver releases bile into the hepatic ducts. If the bile is not required for digestion, it flows through the cystic duct to the gallbladder, where it is stored. The gallbladder can store 40 to 70 ml, 8 to 14 teaspoons, of bile. The gallbladder absorbs water from the bile, making the bile more concentrated. When bile is required for digestion after a meal, the gallbladder contracts and releases it into the cystic duct. The bile then travels to the bile duct and flows into the small intestine, where it breaks down the bile material. What is the role of the gallbladder? The gallbladder contains bile. The gallbladder is a green muscular sac that is about 10 centimeters long and contains about 50 ml of bile. It therefore serves as a reservoir for the bile that is continuously produced by the liver. When we do not eat, the Oddi's sphincter is hermetically sealed and the bile produced in the liver will therefore flow back into the cystic duct towards the gallbladder and fill it. The bile therefore accumulates between meals, interdigestive periods. At the time of the passage of the alimentary bolus in the duodenum, it will contract and allow to supply an important volume of bile in order to facilitate the absorption of food and particularly that of fats in the intestine. Cancer of the gallbladder. Cancer of the gallbladder is the most common cancer of the biliary tract, and the sixth most common digestive cancer in the world. This cancer presents strong geographical disparities. Asia, South America, and Eastern Europe are endemic areas with a high incidence. Western Europe, on the other hand, has a low incidence, less than 5 cases per 100,000 inhabitants. Cancer of the gallbladder is more common in patients over 65 years of age and in women with a female/male ratio that varies from 1 to 5 depending on the region. The female-male gap tends to be higher in endemic areas and lower in areas with low incidence. In France there are approximately 3.3 women affected for 1 man. Causes and prevention of biliary colic. What causes gallstones? Gallstones have many causes: hereditary factors, age, obesity, diabetes, etc. Women are more often affected, especially those who have had several pregnancies. Indeed, female hormones, estrogens, increase the concentration of cholesterol in the bile, thus increasing the risk of gallstones. Hormonal contraceptives and estrogen-based menopause treatments also increase the risk of gallbladder crisis. People with chronic inflammatory bowel disease, Crohn's disease and ulcerative colitis, have a higher risk of gallstones. Finally, certain drug treatments, especially those designed to lower cholesterol, sometimes promote the development of gallstones, but too much cholesterol in the blood does not predispose to biliary colic. Gallstones are most often asymptomatic. In more than 80% of cases, gallstones in the gallbladder cause no symptoms. These asymptomatic gallstones may be discovered during an ultrasound or an X-ray of the abdominal region, performed for another reason, e.g. observation of the liver or kidneys. If there is no discomfort in the patient, further monitoring and diagnosis is unnecessary. Diagnosis of gallstones or vesicular lithiasis. During the consultation, after interviewing the patient, the doctor palpates the abdomen in the epigastric area and under the ribs on the right side. If this causes pain that blocks inspiration, it is suggestive of a diagnosis of vesicular lithiasis. To confirm the presence of stones, an abdominal ultrasound is necessary. This exam allows visualization of the stones, but also the state of the vesicle and bile ducts. It can be sensitive when the ultrasound probe passes over the abdominal wall in the area of the vesicle. Usually it is sufficient to confirm the diagnosis, apart from possible complications. How can biliary colic be prevented? Fight against obesity. Obesity and overweight double the risk of stone formation. It is better to adopt a healthy and balanced diet to prevent them. Avoid meals that are too high in fat or too low in fiber. In particular, reduce your intake of animal fats, butter, cheese, fatty meats, etc., and hydrogenated fats, or trans fatty acids, present in many industrial foods. Avoid periods of fasting. Fasting promotes bile stagnation, the gallbladder contracts less often, and the formation of gallstones. Lose weight reasonably. Don't go on a diet that will make you lose weight too fast, it increases the risk of gallstones. In addition, alternating phases of weight loss and weight gain could lead to the formation of stones. If you need to lose weight, get professional help and opt for a diet that will make you lose weight gently. Get some exercise. Regular physical activity would help reduce the risk of stone formation.